state of agitation is a psychomotor behavior disorder characterized by a motor hyperactivity associated with the loss of control over actions, speech, and thoughts. When encountering any case of agitation, it is important to first rule out any life-threatening emergencies, whether they are of organic or somatic origin. Organic causes can include toxic substances such as alcohol. In this case, will cause delirium tremens or alcoholic encephalopathy. Also, there is cannabis, medications, and withdrawal syndrome. Finally, carbon monoxide poisoning should not be forgotten.
Hey, be careful today, okay?
Neurological causes may involve conditions like epilepsy, brain tumors, meningitis, or stroke. Metabolic causes like severe hypoglycemia, hyponatremia, hypocalcemia, renal failure, or thyroid disease can also contribute. Additionally, don't forget that urinary retention can also be a cause.
I need to pee.
Psychiatric causes of agitation encompass disorders like bipolar disorder, major depression with the manic delusions, generalized anxiety disorder, panic disorder, brief delusions. Schizophrenia can also be a cause, or personality disorder, and sometimes it can be a decompensation of a chronic delusion. The severity of agitation can be determined based on several criteria. This includes difficulty making eye contact, refusal to sit, or inability to stay in one place, and some other severe signs. The therapeutic approach to agitation involves symptomatic treatment in emergency situations, and the first thing to do is to keep the patient in a calm and isolated environment. Plus, you should consider in mind the possibility of hospitalization. An adequate relational approach is important for appropriate care, involving active listening, re-establishing eye contact, and engaging in a dialogue with the patient. It is important to reassure them without passing judgment and to downplay the situation.
It's okay, Tanya. Everything will be okay.
Physical restraint should generally be avoided, except in cases of a very intense agitation where pharmacological sedation is expected. In such instances, strict and regular medical supervision is necessary, and medication treatment options include the use of orally or intramuscularly administered benzodiazepine, as well as an antipsychotic for severe forms of agitations that are associated with delusions and aggressions. For etiological treatment, the management of the major medical emergencies should be prioritized, and referral to a specialized facility may be required depending on the case. Thanks for watching.